There's basically trauma and infection that can and will take you down if it occurs and you're not prepared for it.
Right.
And a simple blister can take you down. It can turn into infection, which can turn into gangrene, which can turn into the need for an amputation, etc. In today's society, we don't think about that. 200 years ago, everybody knew that. But if you're going to have enough macaroni and Kraft macaroni and cheese put back for 3 months if you need it,
Yeah.
wouldn't it make sense to have your blood pressure medication, etc., back as well? Because, either one, starvation or a stroke can kill you. And if you're saying that these situations do not provide for access to emergent care, well, guess what? You're now the emergency physician.
Yeah.
So what are you going to have? What should you have for that? And again, when I say prepared, of course, the first thing that some people are going to come to mind, oh, these are preppers. This isn't really prepping. This is just a couple basic things. If this is prepping, so is having Band-Aids in your medicine cabinet in your bathroom.
Welcome to or back to the Suburban Sheepdog. I'm Grant. I'm the host of this channel. This is where we gather to learn how to take care of our loved ones, family, neighbors, even ourselves. And I'm not sure how you found this particular episode. This is episode 1 in lockdown medicine. Lockdown medicine is how do we take care of ourselves if we're back in a situation where we're forced to stay in for whatever reason. And you may have landed here because you saw the trailer, and if that's the case, you know why we're doing this. If you're finding this for the first time, what we're going to do is talk to a medical doctor, somebody I worked with. I'm a medical practice consultant. I've managed medical practices for 25 years, so I called in a favor of sorts, and I got with a physician who I used to work with who had an interest in this project. And so what we're going to do is we're going to walk you through how you can take care of yourself and your needs should we go into another lockdown, whether it's pandemic related or civil unrest or just whatever it is. You're going to find this very interesting. We're going to cover 3 things rather in depth. There's going to be a split and then there's another episode, but in general, what we're going to talk about is planning ahead for your medications. We're going to also talk about infection, how to deal with that. We're going to also get to trauma. Boy, we don't want to be dealing with trauma by ourselves, but it may come to that, to where we have to be our own first responders, at least in the onset of an emergency. So hang on, this is a great episode. Again, there's a second one to follow, but let's take care of episode 1. Dr. Mike, you're on.
Yeah, I suppose one of the first things you have to consider is what's the time course. If you lose power for 2 hours, it's one thing. If you can't get out for 2 months, that's a vastly different situation. There's the basic things that you need to attend to, just like you did last Monday. Did you take your blood pressure medicine? Did you need insulin? These sort of things. There's things that you can't cover. If you were in the middle of a chemotherapeutic regime for lymphoma, you're not going to be able to continue that in that situation. But can you take your blood pressure medication if you're on a blood thinning medication because you've had clots in your legs or pulmonary emboli, or you have stents in your heart? You need those blood thinning medications. Do you have those on hand? But of course you do have out these basic things to handle your Monday through Friday things you always would. Then on top of that, of course, there's the emergency situation. What are you going to have on hand? What do you need on hand if something goes wrong? There's a bad weather and you're up cleaning your gutters because they're running over and you fall and break your leg. There's basic things like that you may want to cover
Right.
as well.
Right.
And that goes into a whole different set of preparations. But I think the first thing, of course, is just the basics. Handle your basics. Well, this is, in terms of physicians, this is what we always deal with every day in the office. We're treating the patient and we're treating the insurance company. So
Yeah.
in terms of the patient, if the patient says, listen, I'm concerned that I'd be in this situation, I'd run short, and I have a potentially life-saving medication that I can't get access to, I'd like to do the responsible thing. I'll do now, and I will go ahead and get this medication. And your physician may say, sounds reasonable to me, I will give you a prescription for 6 months worth. If whatever. Now your insurer will not pay for that. But if you're willing to pay for it, that's fine. It'll be probably the first time your primary care ever had this discussion with a patient. But afterwards, it wouldn't surprise me if your primary care started thinking, that's not a bad conversation to have with people.
Yeah.
And whereas it might have seemed a bit out there, it might have seemed, what, is this a prepper type person or whatever?
Yeah.
Not now, not after COVID. All of a sudden, everybody's starting to think.
Everybody's had their wake up call.
Now they truly are woke. Yeah.
There you go. The other woke, right? Yep.
No matter how you approach it, people I think probably don't normally think about this, but if you're going to have enough macaroni and Kraft macaroni and cheese put back for 3 months if you need it,
Yeah.
wouldn't it make sense to have your blood pressure medication, etc., back as well? Because either one, starvation or a stroke, can kill you.
Right.
Right.
Probably the stroke faster.
Yeah, right. And but yeah, so that type of thing. And then that's the Monday through Friday stuff. And you were going to want to cover that. But in addition to that, you're going to want to, of course, be prepared for things that might happen a little bit more severe. And if you're saying that these situations do not provide for access to emergent care, well, guess what? You're now the emergency physician.
Yeah.
So what are you going to have? What should you have for that? Well, again, you can go all the way out to extremes and the 0.001% chance of something happening. If you want to, go ahead and cover that. But just the basic things, a couple things that can give you great problems in a situation like that, particularly if you're talking about power outages, clean water, etc. If you go to that point where you can't get that, there's basically trauma and infection that can and will take you down if it occurs and you're not prepared for it.
Right.
So the very first thing is to avoid it. That's although we're going to discuss about how to be prepared for it. The first thing is don't get up on your ladder in the eaves when you don't have an emergency room around you if you can avoid it, so that you don't fall and break your leg. But if you get in that situation, trauma, we'll get to that in a second. Let's start with infection. Infections, broadly speaking, you're going to talk about two different types: the exterior and the interior. In interior, you're talking about basic gastroenterology. You're talking about parasites and things like that you can get in these type of situations. How are you going to get a prescription for a prescription medication for a diagnosis you don't yet have? How is your doctor? Is he going to be open to that?
Yep.
Is he going to say, listen, I just need some metronidazole, a little bit of Flagyl on hand in case I get a parasitic infection? That's a broad medication. It's been around forever. It's dirt cheap. And you could keep that on hand if you were allowed. And if you started you're in a situation where you're becoming a little bit too familiar with the bathroom, you could take that and perhaps cover that type of situation.
Right.
That's the internal. Externally, that's much more common. It could be a burn, it could be a scrape. If you're walking long distances for whatever reason, a simple blister can take you down. It can turn into an infection, which can turn into gangrene, which can turn into the need for an amputation, etc. In today's society, we don't think about that. 200 years ago, everybody knew that. But we're talking about putting ourselves back in a situation much more akin to 200 years ago. So number one, keep yourself out of that situation. Don't get the fracture. Don't get the blister that gets bad. But if you do, there's a couple basic things. The simplest thing, I think, is Neosporin.
Right.
Just keep a tube of Neosporin around. If you get a burn, if you get a scrape, if you get a blister, you can bandage it, etc. But Neosporin is a broad spectrum antibiotic that's going to cover a lot of things that at least you can treat short term and keep yourself from getting bad situations. Avoid the situation always. Avoidance first, treatment afterwards.
Right.
An ounce of prevention, as they say. Then the next step, as we were talking, is there's the topical stuff like Neosporin. The other thing is, what about systemic antibiotics? Well, again, is your physician going to be open to the idea of giving you a prescription for a broad spectrum antibiotic just to have around, just to keep in case this sort of thing sort of happens, so that you could treat it if it happened? So things start getting worse. The Neosporin isn't doing the job. All of a sudden that cut on your leg is starting to look a little more and more red, and there's red streaks starting to come up your leg. And the Neosporin's not going to do it any longer.
Right.
Well, can you convince your physician perhaps to give you, it's harmless enough, your insurance won't pay for it, but once again, this is your choice, to have an antibiotic on hand to stick around. Something as cheap as Ancef is, again, dirt cheap. It is not good for the more bizarre bat bugs that we're getting to see these days, but most of the stuff that you see in your backyard that you're going to get is going to be, it'll treat it, and you could have that on hand. Tetanus is another option. Obviously, keep your tetanus shots up to date,
Well,
because you're not going to be able to run.
Yep.
You won't be able to cover that in
Yep.
hindsight
Yep.
from a rusty nail that you stepped on in your backyard. But yeah, an antibiotic that you can keep around at all times. And again, when I say prepared, of course, the first thing that some people are going to come to mind, oh, these are preppers. This isn't really prepping. This is just a couple basic things. If this is prepping, so is having Band-Aids in your medicine cabinet in your bathroom.
Right.
Well, you're not bleeding now. Well, no, but what's the problem with having some Band-Aids around? You know,
Right.
same type of thing. It's just now we're looking at a whole different potential situation where the things we have taken for granted are not available. And with respect to what you said with the truckers, yes, if this is to happen, the situation that will take us down is not probably the disease, it's the fear of the disease.
Yeah.
That's what will shut everything down. The disease can be bad enough, but yes, when everybody really starts, when you get to a point where you no longer have to be told to stay inside and sequester and to quarantine yourself.
You got 100% compliance.
When you're voluntarily doing that,
Yeah.
you probably got to that point, where you're going, okay, yeah, this is we're gonna tip over, and yes, you're not going to be able to see.
Right.
And in a case like that, we've suggested, what if your pharmacy is not open? Well, what if your pharmacy is open but we can't get anything? Same thing.
Precisely. So yeah. So these aren't unreasonable conversations to have.
Okay, so there it was, episode 1 in the can. Episode 2 to follow. Hopefully I've whet your appetite on this topic. It's life-altering in a way, because as I went through the process of interviewing Dr. Mike, I realized that I had some sketchy parts in my plan. I hadn't thought of everything, and I'm not saying I ever will, but this sure helped. So episode 2 to follow. It's linked to below. We'll see you in that episode. Hey, don't forget to subscribe, hit that notification button. We'll see you down the road. Thank you. God bless. Stay safe.